Hey everyone, welcome to the Future Podcast. Here with you is your host, Aaron Alexander, and myself, Mahat. And
Uh,
hope
to-
wherever you're having a good day.
uh, yeah, I hope that our listeners are having a good day as well. So today we have Dr. Adeel Khan with us. He's an expert in regenerative medicine. We dive into his backstory and we also dive into and try to provide an introduction into regenerative medicine. The commonly used phrase that you might have heard of is PRP. So here we have Dr. Adeel Khan starting off with providing a background into his profile.
Yeah, I think the story is important because there's a lot of people out there struggling or may not have hope, and hopefully my story can give them a little bit of hope. So I wasn't the best student in school, but and even in university, I was kind of a little bit distracted. But eventually, I became a personal trainer, and I really liked fitness and health. And then but it wasn't stimulating enough intellectually. You know what I mean? Like there wasn't that much science behind it, that much intellectual kind of rigor. So it was kind of like, okay, what else can I do to help people? And so medicine just seemed like a natural thing because obviously you just help people in that. And so I was drawn towards it. And then from there, because I was a trainer before, I always liked the idea of natural kind of healing and lifestyle, holistic medicine. And so when I went into medicine, it was I gravitated towards regenerative medicine and functional medicine because it's all about destroying the body without using drugs or surgery and healing from the inside and using your own body to heal, which just fascinated me. And so I just got so passionate about that. And now I'm obsessed with that, and it's just led me to so many cool opportunities around the world. And now I've treated a lot of high-profile people, and it's exciting because now because of that, I have new opportunities and push new research and I keep innovating and helping people from around the world. And so now that's kind of my passion now, just regenerative medicine and raising awareness about that.
Okay. So that was kind of our icebreaker question. Like I came across one of your podcasts, and that's when I found out that you were a personal trainer before getting into medicine. So is there anything specific that led you to choose medicine, and how did you get into regenerative medicine specifically?
Honestly, it sounds silly, but it's honestly just I wanted to just help people. I know
Okay.
it's not there's no like magical answer or something. It's just a very simple thing, but I think I think I was just gravitating towards it because of I guess the difficulty of it too. I always wanted to challenge myself, and it felt like medicine was very hard to get into in Ontario, especially in Canada. And so I was just like, because it was difficult to get into, I wanted to push myself and see if I could do it. But then at the same time, I knew if I could do it, I could help a lot of people. And so, and then regenerative medicine was just kind of at its infancy when I started. Like when I started med school, I mean, it wasn't even a thing. When I finished my training, it started taking off, and in the last few years, it's kind of exploded, and now it's gonna keep growing. In terms of where it's headed and the disruption it's going to cause in medicine. So it's a pretty cool field to be in, and I want to really raise awareness about it and specialize and use that regenerative medicine kind of template to help people in different specialties, not just like orthopedics like mine, but you can use it to help cardiology, you can help it like heart, you can help it to help liver, kidney, even diabetes, they've used it for Parkinson's disease, all sorts of stuff. So it's a cool area to be in because there's so many applications with with stem cells and all this stuff.
Okay.
So, for someone like who doesn't have any idea about like regenerative medicine, like how would you like explain it like simply, at the most basic level in basic
Yeah,
language?
I think the basic way to just think about it is like if you get a cut on your hand and your body heals it on its own, right? So your body has natural regenerative potential. Everyone knows your body regenerates from that perspective. If you get a wound, your body can heal on its own for the most part. Now, what we're doing is we're basically concentrating or taking out those regenerative molecules in your body, which are like little substances that promote healing, and just isolating them and then injecting them or infusing them back into your body to promote healing. So it's basically taking your natural healing substances and putting them back in to promote healing, because sometimes that healing doesn't happen on its own.
Okay.
Something that I've come across in my research was like areas like the knee, the blood flow is naturally not as high as it should be to aid the healing process. Is that correct?
Yeah, no, for a lot of cartilage injuries. So you're probably referring to cartilage in the knee. So cartilage is like, think of it like Jello. It's like a Jello cushion substance that protects your knee, and it can wear out over time and doesn't have good blood flow. So what if you get a cartilage injury, you're kind of screwed because you're basically like, it won't heal on its own. And then you can do physio, and or sometimes physio doesn't work. And then the only other option is surgery. But surgery, they don't really do much. They just clean it out, or they do something called microfracture, where they drill holes to try to promote healing. But those aren't great outcomes. So the only way to really restore function is to restore the structure. And the only way to restore the structure is to repair the cartilage, which you can do with using regenerative therapies. So that's kind of the whole principle behind healing, not only in the knee, but in different cartilage injuries.
And
Yeah, go ahead, Aaron.
Is that where scaffolding comes into play?
Yeah, so sometimes with a big defect, like if you have a cartilage defect, you need the stem cells with like like usually we use what's called collagen scaffolds, and collagen is like that cushiony Jello-like molecule that helps to make it feel like Jello. Like most people are familiar with collagen because they know they've heard of lip fillers and women putting fillers in their lips and face. That's basically the stuff that makes your skin look nice and plump. And now you can use 3D bioprinters and print a collagen scaffold, and then you can use that with stem cells and seed it, and then you can actually regenerate like full tissue. So that's true regenerative medicine. And that's the problem with regenerative medicine too, is the terms are not properly used. Like if I'm injecting PRP into you or just stem cells and not growing them or not using a scaffold, then it's not really regenerative. It's more just anti-inflammatory, meaning it modulates the immune system, and it decreases inflammation, and it'll help with pain for sure. And it can last a few years, or it can even be permanent depending on the type of injury. But you're not really regrowing tissue unless you're using cultured and expanded stem cells, which means you're growing them in the lab, or you're using it with the scaffold. And so it's a hot area of research right now, is figuring out what type of scaffold is the best. But it seems like a collagen-based scaffold is most likely the best because it mimics real tissue, and it has the same bio kind of tensile strength and everything.
Mm. So like we also see that you're an active practitioner. So is there any case that's like, most people come, like the higher case, higher average, that's more common among your patients, or what disease, or what would be the most treated thing at your place?
Yeah, I mean, by far it's knee osteoarthritis, I would say. And osteoarthritis is just a wear and tear condition. I'm sure most people have heard of it. As you get older, your joints wear out. But what also happens is some people get a lot of inflammation in their joints. We don't always know what causes the inflammation, but the inflammation basically leads to degradation of the cartilage, meaning the inflammation eats away at the cartilage. So if it eats away at the cartilage, and you have less cushion over time, and then it wears out, and that causes more inflammation and more pain. And then that's why people sometimes say like bone on bone, because they feel like, their bones contacting each other because there's no cushion there to protect it. So that's probably the most common thing, I would say, osteoarthritis. And then maybe the second most common is like back pain. You see a lot of back pain for sure too. I mean, lifetime prevalence of back pain is almost like 100%. Almost everyone gets back pain at one point in their life. But most people get better with just physio and time and rest, but some people don't. And those are people we help a lot.
So it's mostly older people. Would you say that, or?
No, the youngest patient I treated was a 14-year-old girl, elite gymnast for Team Canada. And I treated a 96-year-old Korean man. So
that's a wide range.
Huge range, yeah.
Is there any research being, sorry?
No, go ahead. I'll just ask.
Okay. Is there any research being done into the causes of inflammation? If you're trying to work backwards?
Yeah, for sure. There's so much, because you want to see what's the root cause. And it seems like the root cause in most cases is lifestyle based. So meaning if you're not exercising properly for your body, you're not eating properly, you're stressed, you're not sleeping properly, you're lonely, or you don't have a good sense of community, like sense of support, all that lifestyle stuff, that really health and wellness space. But the problem with the health and wellness space is that there's a lot of gimmicks and a lot of marketing, but the reality is most people just need to eat better and move properly, and they don't know how to do that. So for their body, and that's what leads to inflammation. Think of inflammation just like your body's response to an injury, right? If you get a cut, like we said earlier, like if you get a cut on the hand, the reason it heals is because the inflammatory cells come in there and help to promote healing. But acute inflammation is okay. It's the chronic inflammation that's the problem. When chronic inflammation it stays there. It's like a fire that doesn't go away. And so how do we put out that fire is a question. You can use lifestyle, you can use supplements. Sometimes that's enough, but sometimes you need the stem cells or the PRP to put out that fire.
Yeah, I mean, I was only about to ask you, like, do you think there's going to be a rise in such cases in the younger generations? Because we do spend a lot of time, sitting around and.
Oh, 100%. I've seen it. I've seen it since in the last few years. It's crazy. I see so many people 20 to 25. I mean, maybe it's because of my social media presence too, but I don't know. Like, I can see so many young people with injuries and pain. I'm surprised, to be honest. I'm actually like, it's making me worried because I'm like, what's going on with young people? Like, why are there so many people in pain? It's crazy. Because you always think, whenever you think about pain, chronic pain, you think about older people, but there's so many young people.
I mean, there are memes about how we don't have a posture. We sit like a crayfish or something. So
yeah, and it comes back to the same principle of knowing how to move your body properly, right?
Yeah. Are there any resources or tips that you could share right now for us younger? I mean, you're not that old yourself, so like our generation, yeah.
Yes, I'm a millennial. I don't know if you guys are millennials or Generation Z, but I think honestly the best resource on this topic, I would say for general maintenance and health, it's called DNS, Dynamic Neuromuscular Stabilization, and they have a school in Prague, in Czech Republic, and they talk all about how to move your body properly, what type of movements to do to maintain your body. And essentially the principle, just to give you an overview, is basically just modeling how babies move. Because babies, essentially, if you see them, they squat properly, they do all the movements, but over time we lose those because we stop doing them. So DNS is all about restoring those movement principles that we lose over time. And I think that's really important for people to keep part of their weekly routines, because if you don't move properly, like your body's just gonna lose its capacity to do things. So I call it movement nutrition. So, just like you feed your body food, you need to feed movement in as well into your practice.
Yeah, I mean, that brings us to food, I think. Do you have a diet preference? I saw that you were against people, totally giving up meat or something like that. So what are your thoughts about veganism? And I mean, what do you, maybe a personal preference, but what do you?
Yeah, I don't have a dogmatic, like one size fits all. I'm not against vegan and I'm not against carnivore. I just don't think it makes sense for everyone because it's individual. And I made a YouTube video about it, so your viewers could definitely check it out. Basically talking about how to make a customized nutrition plan for your body, because you have to use blood work and you can also use subjective, feelings like how you feel energy-wise and mood and all that stuff. Based off that, you can decide what nutrition plan makes the most sense for you. It doesn't make sense to just say, oh, you should do keto or you should do vegan, you should do carnivore. You don't know because everybody responds differently. So one of the easiest tools is to get a continuous glucose monitor. It's called a CGM. And you just measure your blood glucose levels and see how they fluctuate in response to different foods, and then decide based off that what foods you should avoid and what foods you should eat. Because you and me can both eat a banana and my blood sugar goes crazy and nothing happens to your blood sugar. So then that means obviously I shouldn't be eating bananas because it's going to trigger more inflammation and more insulin response than someone like you. So the only way to know that is to measure it.
So higher glucose is linked to more inflammation.
Yes, because of insulin.
Right. Okay.
So
I can kind of move on to the cyto-rich PRP that you're using right now. So I'm curious about the process of how you are increasing the presence of cytokines in the PRP.
Yeah. So we actually incubate it. So when we incubate it, it enhances the plasma. This was a discovery that our scientists and our Dr. Dahlia made basically a few years ago. And then we just, we've been able to replicate the results, and now we're doing large trials around the world. And we're actually going to be manufacturing hopefully some of our kits in India and in Dubai and Pakistan, and then sell them to different clinics around there. So then everyone has access to cyto-rich. It's not just exclusive to us. Because I think cyto-rich can help a lot of people, because as we were talking earlier, chronic inflammation is a problem for so many people. And this basically is like a giant fire hose that puts out the fire because it's so anti-inflammatory. So cytokines are basically little messenger cells. They send signals that decrease inflammation. And by incubating the plasma, it basically increases or enhances the anti-inflammatory component of it. So that enhancement of the anti-inflammatory component is what really puts out the fire.
Okay.
So, but when you say about chronic inflammation, it is staying there for some reason, right? Like there has to be some injury that is not treated. So inflammations is a symptom.
Yeah,
right?
exactly. It's a response to an injury. Yeah.
So if you take away the inflammation, but not addressing the root cause, is that effective? Is that what the thing is about?
Yeah, you still get, because most people's issue is pain, right? So they want to get rid of their pain. So it gets rid of their pain, but you're right, it won't cure it. It can last for 1 to 2 years. And then you have to do it again potentially for inflammation. And then after that, then there may be other options if they want something more permanent. Like that's where stem cells come in and 3D bioprinting. If you want to actually regrow new tissue, that's the only way to do it.
Oh, so is it expensive?
But if we're injecting, but like for example, if you're injecting like a tendon, like a chronic tendon issue, it can actually regenerate the tendon, and it still has a regenerative effect. So it's not just anti-inflammatory. There's a little bit of regenerative effect. But like for cartilage, it won't regrow cartilage to a significant degree. It's mainly anti-inflammatory. But for muscle and tendon, it's regenerative.
So is this expensive?
I mean, it depends what you mean. I guess like a lot of people on their health, when it comes to their health, people are willing to spend for the most part. And we try to make it accessible. Like, it's around $1,000 Canadian for an injection, but or 2,000 if you're doing this fine. But like it just depends on what we're doing. But at the end of the day, we try to make, we do have like hardship pricing and payment plans, stuff like that, just to make it easy. Because at the end of the day, we want to make it accessible to people.
Okay.
And I don't think anyone, I think for the most part, people are willing to spend on their health. And if you think about it, a lot of people spend money on like, silly things all the time. And so when it comes to the health, like, you should prioritize that anyway.
I mean, but like you said, if the more mainstream it becomes, there are chances that it could, the prices could drop and eventually
exactly
accessibility will increase. So I see that you're a good practitioner, that you're spreading it now anyway at the forefront.
Yeah, to me, it's not about necessarily, I don't need more business or whatever. It's more just about helping more people and raise awareness and stuff.
We had a friend of ours who has completed her MBBS, and so she had put across this question to us, asking like she noticed that PRP is usually charged higher. It has a higher cost. Is it just a business? Like, is it just a market that's being taken advantage of, or are there specific elements?
Yeah,
for why?
No, she's right. There's a lot of bad players in the space. And I mean, that's why I got flown into Dubai, right, to treat Mohammed Alibar, is because, yeah, there's like 100 people doing PRP in Dubai, but why didn't he fly me across the world to treat him? Because we're doing it the right way, and there's not a lot of people doing it the right way because they haven't been trained properly. I was trained by the guy who invented it, Dr. Dalik is the first one in the world to do it for athletes. So he's a pioneer of it. So obviously he knows more about PRP than anywhere else in the world. And because of him, I know more than most people. And I've also learned and innovated on my own too. But with his knowledge and my knowledge now, we kind of know to do it the right way. And we're trying to we're working with the Canada Research Channel right now to create a database so that physicians can access the database and they know what PRP works for and what it doesn't. And the reason why there's so much mixed evidence for your friend to know is because most of the research doesn't communicate the fact that there's different cytokine profiles or characterization of the PRP. Like, say if you order a pizza, you just say, I want pizza. It's like, what does that mean? It doesn't mean, do you want cheese pizza? Do you want mushrooms? Do you want chicken? Do you want pepperoni? Like, what do you want on it, right? It's like PRP. I want PRP. So what is that? That doesn't mean anything. You have to qualify it and say, what kind of PRP do you want? And that's the problem. Like, people don't even know there's different types of PRP, and doctors don't even know that. So it's like you have this whole issue that they don't understand there's different types used for different issues, and you're just kind of using PRP haphazardly without knowing the science behind it.
Okay.
So like different types, can you elaborate more on that? Like what different?
Yeah, there's ones that are going to trigger inflammation, and then there's ones that are going to reduce inflammation. So like the cyto-rich is anti-inflammatory, so it's good to use for joints and chronic inflammation. But regular PRP or standard PRP is more pro-inflammatory. So why would you put that into joints? especially if it has cells in there or red blood cells. That's what's going to cause more problems down the road because it's going to trigger more inflammation. So you only want to trigger inflammation for like chronic muscle tears because you want to promote inflammation to help the tear heal. But for most other things, you want to reduce inflammation. So it's not the right approach for a lot of chronic conditions. So that's the main difference. Like there's inflammatory types of PIP and then there's anti-inflammatory types of PIP. I think that's the two main classes I would say.
Okay. Two ways. Are you willing to share how you got in touch with Dr. Anthony Galia? I feel like that's played quite a pivotal role in how you've shaped your career, the information you were exposed to.
Oh, definitely. It's honestly for all the young people, having a good mentor makes all the difference in the world. And he's been my mentor, and it's been amazing because he's a leader in the field, and I've learned so much from him. So essentially, what we would do is what I did actually is I had a friend from the gym who knew I was into lifting and working out, and I was a med student, and then he was kind of just like, oh, you should check out this doctor because he was a patient of his. So I went to go see him, and I was like, oh, this is amazing stuff. It's like so different.
Sorry, doctor. I can't. This Zoom has like a 40-minute limit. Can we join back to the same room?
Yeah, no problem.
We'll get started on the question again.
Okay.
The question was the importance that Dr. Anthony Galia played in your life, how you came to meet him, and the importance of mentorship.
Yeah, and honestly, if there's one thing I can tell anyone who's trying to figure out what to do with their life, is find a good mentor and don't just do it haphazardly. Research them, make sure there's someone who's either the best in their field or whatever you want to do. Find the best person, and even if they say no, you don't take no for an answer. You know what I mean? Like you got to be persistent too, and that's what I did with even Dr. Galia. Even though I got introduced to him with the gym friend, he didn't take me on as a resident, which means like I was still in training, and I wanted to do an elective with him. So I wanted to spend like a month with him just to get some hands-on experience. And then his staff kept saying no, he doesn't take residents, no. And then I tried for 2 years straight, and I just kept saying no. And I kept saying no, I'm gonna come, I don't care. Okay. And then eventually I got one of my other doctor colleagues who was who's a supervisor during one of my other electives, and he knew Tony, and so he put in a word, and then finally they said yes, and then so I got to spend a month with him, and he liked me, and it worked out great, and then he hired me, and then the rest is history, I guess.
Well, what sort of follow-up cycle did you have? Like, obviously, you don't want to be too pushy, so like, how did you spread that out?
Yeah, I think I tried like persistently for 2 months, and then after they said no, I waited another year, basically, and then I tried it persistently again for a month, and then I wasn't getting anywhere, and then eventually I used that other doctor to be like, can you please try to help me with this? And then he helped, and then I was able to get in. Yeah. Okay. So yeah, definitely you don't want to be annoying because you don't want to be emailing them every day or calling them every day. But at the same time, you got to show them how interested and passionate, because people are always going to say no to you for no matter what you want to do in your life. You're always going to say have a no or a failure or whatever. I think the key is just not to take it personally, and if it's something you really want to do, you got to just be relentless, which is just keep going even if you don't feel like it.
Okay. And I believe Dr. Galia's institute is called Institute of Human Mechanics.
Yeah.
Okay, I'm just putting that across for reference. Another question that I have is, in another podcast that you had done, you had spoken about how it's unfortunate that a lot of doctors practicing medical practitioners often resort to surgery as the solution when it might be possible for treatments like PRP to help the patient. So do you have any ideas, and are you taking any steps to help create some sort of systemic change so that the medical body as a whole can move and they can adapt to newer technologies quicker and regulate?
Yeah, for sure. That's exactly what we're doing. So I think I mentioned it a little bit earlier, but basically me and Tony had a meeting with the Canada Research Chair last week. So he's like the highest level of research there is in Canada in terms of like academic output, and we're going to work with him to create an orthobiologic database. which means that sorry, I'm outside, it's windy. I guess there's a storm coming, sorry about my hair. But yeah, so anyway, so basically what we're going to do is we're going to take all the data that's out there for PRP and then extract it manually. So there's going to be a lot of work, but we're going to get master level researchers to help us do it. And then we're going to know, what doesn't work or what doesn't, and why didn't it work. And then we already kind of know the reason why it doesn't work in some studies is because they don't characterize the type of PRP, or they don't use image guidance. So they're not using the right type, And PRP is obviously not 100% guarantee, but it's also not like 50-50. It's more like 90-95% depending on the issue. So it has pretty high success rates, and it's obviously not surgical, less invasive. So almost every patient would rather try that first and go to surgery. So we're gonna hopefully that's exactly why we're doing that project, to push the field forward, and to create like an objective database.
Is there anywhere that people can follow this? It can be medical practitioners themselves, or it can be like the general
it's called ortho evidence. Oh yeah, just like ortho evidence, and we're going to create a database with them. So they can keep an eye out for that if they register with their website.
Right. So what sort of
I wanted to ask
you?
Yeah. Go ahead.
What sort of timeline are we looking at?
1 year probably.
Yeah, I wanted to ask about like arthritis and how effective is this in rheumatoid arthritis though? Like, is it being treated or
it's not meant for rheumatoid, it's meant for osteoarthritis. And that's the whole idea, is that we're probably going to eventually, because of the way the science is going, we can make a PRP more for rheumatoid arthritis. So we can target the cytokine profile for rheumatoid arthritis, and for nerves, and for so that's something we have on the back of our minds, is to change the cytokine profile to target the different pathologies. And that's the way to do it, right? You go do the basic science and then you do the clinical application. Having said that, something like stem cells, which think of them like a more powerful version of PRP in terms of anti-inflammatory effect, they can still work for rheumatoid arthritis because they're just so anti-inflammatory. They decrease inflammation for all the different cytokines. So for one thing I'm going to be doing in Dubai is be treating people with rheumatoid arthritis using stem cells and using something called exosomes, which are like little cargo messengers that have anti-inflammatory molecules inside them.
Okay. So this is again, I hope I'm wrong in saying this, but is it still a band-aid solution? Like rheumatoid arthritis, as far as I'm aware, is a immunodeficiency disease.
Yes. Well, the thing is, even with like the drugs that they give you, methotrexate, right? They're all band-aids, but those have way worse side effects, versus like something like IV stem cells. I guess sorry, I think there's like a storm coming. Give me 1 sec here.
Sure. No worries.
Are you safe?
Yeah, no, it's fine. I'm on the waterfront, so I'm just like keeping an eye out. Yeah, okay. So anyway, sorry about that. Yeah, so basically, the IV stem cells or IV exosomes, which have so IV exosomes basically don't have any cells in them. So meaning they're just purely anti-inflammatory signals that go through the whole body, but they can actually get rid of the inflammation. And if you get rid of the inflammation, then rheumatoid arthritis is just a purely inflammatory condition. So if you get rid of the inflammation, then the condition gets better. It may not be permanent, but it could last at least a few years, and that's better than taking drugs, which are very toxic to your body and can, cause immunosuppression, increase the risk of cancer, and all sorts of side effects. So I think in terms of like Band-Aid solution, I don't think it's necessarily Band-Aid because it may not cure it permanently, but it's very long lasting and there's minimal side effects, Yeah, no, I get people with RA reach out to me all the time. And unfortunately right now we don't have anything great to offer them in Canada, but I think in Dubai, I'll be able to do some new therapies for them that should be helpful.
So all of this comes under stem cell therapy, like broadly, PRP is considered under stem cell therapy, or is it different, would you say?
It's more regenerative, or orthobiologics is like the general term for it. So orthobiologics just means any biological substances from your body, whether they're stem cells or therapy or exosomes, that just promote healing in tissue and tendon and muscle. So orthobiologics is like the large category term, and then there's more individual, characterization of PRP, stem cells, exosomes, and there's different types of each of those.
Yeah, because we also want to like know your thoughts about like why the stem cell field is like really controversial. I know it's not you're really into that, but why is it so controversial? Like because there are warnings all over.
Well, because the reason it was controversial before was because of something called embryonic stem cells, which means they were using human embryos and taking the stem cells from there. So that's obviously controversial because some people argue that's a life, or like a potential living creature that you're taking away. So that's why people were controversial before. But now we don't need embryonic stem cells. We can use your own body stem cells, or we can use allogenic stem cells, which are from donors, if the body of the person is not healthy. And those stem cells are safe to use, and they're still effective. Think of stem cells as just like little molecules that help reduce inflammation, but if done correctly, like with culture and expanding and bioprinting, they're like little cell fractures, which means they can actually regrow new tissue.
Okay, so one of my friend is like working in the healthcare field, and so she was telling that she came across cases where maybe this was I don't know, in pediatrics the case had gone wrong where the stem cell therapies had set back progress that the patient had made. So there are concerns like that. What are your thoughts about, have you come across something like that?
Well, the problem is, and this is another reason it's controversial, is there's a lot of people doing it, but they're not doing it properly. And again, it just comes to poor education and not knowing the right mentors and the right people in the field. So I've never had anyone get worse from like the treatments that we do. So that to me just sounds like they probably use the wrong type of treatment, like the wrong type of stem cell. And that's where it becomes important to have someone who's an expert and who kind of does this day in, day out versus someone who just kind of does it sometimes, So you just have to be very careful who you go to regenerative therapy for. There's so many people offering it, but not that many people actually know what they're doing.
We had two more friends who mentioned specific conditions that they are facing, and we would like to know whether regenerative medicine or PRP specifically can be of assistance to them. One of our friends has scoliosis. Is PRP and a possible treatment for scoliosis?
I mean, scoliosis is more a mechanical thing, but if they have pain in the joint or in the disc, then yes, we can still treat it because it can help to regenerate the disc, or it can help to decrease inflammation. So it's obviously not going to fix the scoliosis, but what you can do too is you can inject around the spine to help stabilize the ligaments so the scoliosis doesn't get worse over time. So you can help stabilize and strengthen the spine, and then also help to decrease inflammation and pain if pain is an issue.
Okay. So the specific conditions that he has, he still has an implant, like he has the rods implanted in his spine, and he has pain on his upper back. So that's where he's facing his pain.
Yeah, I treated people like that before.
Okay. And the other conditions that we had were cervical spondylitis and thoracic outlet syndrome.
Cervical spondylitis. Yes, we treat that all the time because that's just inflammation and arthritis in the joints. Thoracic outlet syndrome, not so much. It depends on what the cause is, but usually that's the surgical solution.
Right.
Because they have to decompress a nerve or remove the bone or something. So it's usually not PRP. That can fix that.
Okay. And this is our last question. To try and end it on a positive note, could you pick a highlight that this career of yours, I'm not sure if you'd like to call it a career. I believe you're far too passionate for it to be called a career. So if you could pick one highlight from your tenure, which one would you pick?
I think it's definitely treating Mohammed Alibar, just because he's obviously one of the richest men in Dubai. He's friends with the royal family. He's connected to other billionaires, Bollywood celebrities, and so there's a lot of people who want me to treat them now because of him. And it just gives me access to a whole new network. Plus, it gives me an opportunity to invest. He said he wants to invest with us, and we're going to make a clinic in Dubai, like a stem cell clinic. So we can do some exciting stuff. So I think that was definitely life-changing for me. As you saw when I was in Dubai, it was a little bit stressful, but everything ended up going well. But it was an amazing opportunity just it kind of changed the trajectory of my career, I think. So now I just have so many more doors open, and medicine for me will be just like a fun kind of playground to do different things and help people from around the world. And while I can still focus on some of my business things as well, because otherwise, if you get too much into the daily stuff of medicine, then you never have an opportunity to be creative and think outside the box. So it's important to not work too much and take time to actually think and focus.
I'm definitely glad to have been part of a life-changing moment for you. So I'm wishing you good luck. Hope to see you soon again in Dubai. Hope that the project is progressing. And
yeah, thank you. I'll be there in January. So.
Okay, perfect.
Thank you
I do get inquiries asking when are you coming back to Dubai. So
just add them to the wait list.
Sure.
I'll be there in January. I'll be treating the world champion arm wrestler and the world champion powerlifter. Those will be my first two patients, and we'll be making some content and stuff. Okay,
sure. So again, thank you for joining us. We hope that the session has been informative, and if anybody wants to reach out to you, I think your email is the best way to go. Yeah, it's on my Instagram. You just go on contact info. Anyone, I'm very accessible. Just email me. I'm happy to help and answer questions and whatever. Yep. Okay, cool. Thank you so much.